morning, and thank you for joining me and City of Gary Health Department Commissioner Dr. Roland Walker for joining us for this COVID-19 update. Soon we will mark 1 year in our campaign against the spread of the COVID-19 virus in and around the City of Gary. As we all know, it's been a difficult fight that, as I often say, has taken many twists and turns. It seems that nothing about this challenge has been predictable, but I'm proud of the way that you and our friends and family members and neighbors, for that fact, have faced this truly historic and unprecedented public health crisis. With the support of the Gary Common Council, we've been able to put in place a mask face covering mandate with real enforcement built into that ordinance. Our houses of worship and small businesses have mostly been compliant with the executive orders, all policies and procedures, and they've certainly contributed to help protect the public. Now that we're moving forward, we also are going to introduce the vaccination plans for our community. Here in Gary, we've been following Indiana Governor Eric Holcomb's lead and the Indiana State Public Health Department's guidelines in our COVID-19 testing, as well as other areas in our fight against the virus. Soon, I expect to announce phase 3 of our vaccination plan. Can't share many of the details with you now, but we're working with the Archdiocese of Gary to identify a location and roll out a plan for the next phase. I will also have another smaller opportunity or venue, looking for smaller venues throughout the city, actually, to be able to provide more access to all of our residents. Dr. Walker will be joining you shortly with the recent updates and current numbers on the status, but if you want more details on our decline or what's exactly happening with COVID these days, visit our City of Gary's website at gary.gov. In late November, Dr. Walker issued an order that actually affected certain businesses, specifically bars, nightclubs, and social clubs. That order called for businesses to allow up to 50% capacity, and it called for them to close by midnight. For now, we're going to ease the closing time and allow those businesses to stay open until 1 a.m., although they must still not allow more than 50% of their capacity at any particular time. We're still calling on our houses of worship to limit their in-person attendance to 200 people at a time, and we're still calling on you to practice good social distancing, and as well as the houses of worship in their services. Hosting services online remains the safest way to conduct services, if you will. If you're running a retail business or establishment, restaurant, you can still allow up to 50% capacity inside your businesses. But all of your employees, your customers, and you, of course, must wear face coverings inside your places of business. At this time, we'll ask Dr. Walker to join us with more detailed information. Thank you.
Well, good morning. Good morning to the citizens of Gary. Thank you, Mayor Prince, for allowing me to address our citizens today. Also, I'd like to say thank you to our City Council, as the Mayor just indicated, for working with us, because it was really important, like he said, that our council affirmed his executive order about face coverings. Working with the Mayor, the City Council, I think that has done a lot to protect the citizens of Gary, so I'm grateful to the City Council as well as to the Mayor. Thank you to the citizens of Gary for allowing me to come into your home today and speak to you about this really important issue, COVID-19. What I always do is I review the numbers with you first, tell you what they mean and how they affect us and what we're going to do going forward. First of all, for the state of Indiana, as of the 23rd of January, there were 2,565 new positive cases for a total of 611,039 total cases presented in the state of Indiana. Now, the unique positive rate, that means the positivity rate for people testing positive the first time and not repeating that for secondary positive tests, is at 18.5% still for the state of Indiana. On the 23rd, we had 23 new deaths for a total, unfortunately, of 9,340 deaths in the state of Indiana. In the United States now, we've had over 400,000 deaths related to COVID. So when you think about it, in a nation of approximately 330 million people, that is greater than 1.2 people per 1,000 have died. Now, that's not our rate. That's the total rate of people in the country that have died because of COVID. So more than one person per 1,000 people have died because of COVID. In Lake County, as of the 23rd, we had 160 new cases. So a total of 45,508 cases in the state of, in the county of Lake, with a unique positivity rate, which is the same as what I explained for Indiana, which is the first positive test. And that is also at 18.5, with one new death in the county, and unfortunately 685 deaths in the Lake County. Now, for Gary, we have the most recent numbers as of the 24th of January. We have 12 new positives, and with January being on track to be having the most positive cases and also on track to being the deadliest month, we have 479 cases in January for a total of 4,671 cases. Unfortunately, we've had one new death. So January, once again, being on track to being one of the most deadly, or if not the most deadly, there have been 12 deaths in the city of Gary related to COVID. So unfortunately now, we've had 137 deaths. But some positive note is that our moving 7-day average is now 12. That is way down. And so I will go into some details later of some of the steps that we can take now that our rolling 7-day average is 7 cases a day. First, I want to cover our testing sites so you know where you can go to get tested. Of course, at the Gary Health Department, there's Pcr Antigen Testing, as most of you are familiar with now. That is the test where we take a probe and stick it into your nasal cavity and swab. It is the most accurate test available. So that's at the Gary Health Department. If you're not familiar with the address, that's 1145 West 5th Avenue. Testing is Tuesday through Saturday from 9:30 a.m. through 5 p.m. On Saturdays, actually, from 9:30 a.m. to 2 p.m. Gary now has a rapid test center, both rapid antigen and antibody, and the antibody can tell you about current and previous infections. And that is at Hudson Campbell, 455 Massachusetts Street, Gary, Indiana. And there are hours Monday through Saturday. Also, the state has a separate antigen PCR testing site again, and that's going to be at the GNS, Gary Neighborhood Services, at 300 West 21st Avenue, and those hours are 9 a.m. to 5 p.m. Now, the subject that everybody wants to talk about is vaccine. Now, you know, I personally am pushing strong for everybody to want to take the vaccine. I have now been fully vaccinated with 2 doses. I've had been greater than 2 weeks since I've had my second dose, still standing here, didn't grow a third arm. Will tell you that the urban legends you hear are false. Now, with vaccines, you expect there to be some side effects. Even with vaccines, you expect fatality, acceptable limits. There are no known confirmed cases of fatality with over 12 million people vaccinated. There are some possible associations, but there are no known confirmed fatalities. So you think about that. Greater than 1 in 1,000 people in this country have died of COVID, but now there have been greater than 12 million vaccines with no confirmed deaths. I just wanted you to take those numbers. If you play the lottery, which numbers would you go with? None in 12 million, or would you go with 1 in 1,000? Okay, so who qualifies to take the vaccine? Healthcare workers, first responders. Currently, our age is still people 70 and over. The questions I get a lot about are teachers being offered the vaccination. Currently, in the state of Indiana and in the Gary Health Department, we have to go by the recommendations made by the health commissioner for the state of Indiana. They supply us, so they're part of our supply chain. And so I do agree that I think the teachers should be part of the first people vaccinated. That is not currently the policy, but we're looking forward to that changing. And one of the reasons why I should also tell you that I think it is so important that we go with that with teachers is that kids are going to be the last people to be vaccinated. So they're going to be a vector. They're going to be holding on to vaccine, right? I mean, pardon me, to virus. And the teachers will be exposed to those kids who are not going to be vaccinated and probably won't start those vaccinations till probably early fall if things go to plan. So we do agree that that should occur. Also, we don't know when the age will be lowered, but please pay attention to the state website, pay attention to the Gary website, and then we will move accordingly with the next group. Currently, vaccines in Gary are being offered in two locations. That is the Gary Health Department, 1145 West 5th Avenue, and Methodist Hospital, North Lake Campus. Both of those are by appointment only. Where can you register? So I'll give you this information. The registration website is which everybody has to go through is www.ourshot.in.gov. So that's www.ourshot.in.gov. That is your registration site. And the reason why you have to be registered there, not only does that help us keep the appointment with the demand, but it also is the same place where later you will be able to be documented that you are vaccinated. Those are very important things, so you have to be in the system. Now, we are very, very, very aware that some people are not technologically savvy or may not have internet access, so the state has provided us with a 211 number. So if you have access to 211, you can call and somebody in the state will help register. Also, at the Gary Health Department, we are registering people by phone with volunteers. First of all, I want to say thank you to the NAACP, to the Urban League, to Alpha Phi Alpha Fraternity Incorporated, to Alpha Kappa Alpha Fraternity Incorporated, and many other organizations that too numerous for me to remember have provided volunteers for that phone number. So that number you can call, leave a message, somebody will call you back, and they will help you register. They will register for you while you are on the phone. So we're greatly appreciative to all the organizations that have stepped up and provided us with countless number of volunteers to help people who do not have access. Now, also going forward with our vaccinations, as the mayor said, our plan is to have an open pod at Holy Angels Gymnasium. They provide us with ample parking, with a good place for this to occur, good proximity to the health department, so that helps us to prepare for an open pod. Now, what is an open pod? An open pod will be open to the public when we're able to announce it. We're not able to announce when that is yet. We have to go by the state guidelines. If you don't follow exactly what the state says, we are in danger of losing our supply and not being able to vaccinate. So we will follow that. Also, we do know that we'll be having several closed pods. So this is part of our emergency preparedness plan. This is why we have an emergency preparedness grant and an emergency preparedness coordinator. Brownie Downs Burnett is our emergency preparedness director. I know that we've arranged to have closed pods so far in Indiana University Northwest, and we always have an agreement with U.S. Steel, so we are planning for closed pods there, and there probably are many others that I cannot think of currently. And then also, as the mayor said, we'll be looking for other smaller sites to have open pods to have access. Now, obviously, when you have these pods, you have to have the people to man them, you have to have supply, and so we are working toward those ends. Now, the great news for today is that our rolling 7-day average is down to 12. We've seen our rolling 7-day average over 50, currently is down to 12. We are confident now that we've seen the end of any holiday surge, and so that is why we made the recommendation, and the mayor has made the decision to follow the recommendation that we're allowing clubs and bars to stay open to 1 a.m. Now, that 1 a.m. is without exception. That means that bars and clubs should plan to have all patrons out by 1 a.m., and so they need to start ushering people out early. So 1 a.m. is the time, and after that, you will be fine if you still have patrons inside your bars and your clubs. 50% capacity still is in place, and we'll be watching closely. We are very happy with the direction we're moving, but we have to remain diligent in what we're doing. We're fighting a good fight. We need to continue to take the steps I'm extremely grateful to the citizens of Gary for taking time to listen to me and listen to my recommendations, and I'm extremely grateful to our mayor who has enacted these things to keep our citizens safe. And I will turn it back over to the mayor now. Thank you so much, Mayor Prince.
Thank you, Dr. Walker. As always, professional, very thorough report. And as I was listening to your report, I received several text messages from our constituents thanking you particularly, but thanking the city of Gary for continuing to share the information. So thank you very, very much. One of the things that Dr. Walker mentioned are our partner agencies and organizations that help to continue to spread the word. I too, on behalf of the city, would like to thank them for their assistance and certainly their expertise in areas that we may not have been able to traverse, particularly as it relates to getting the word out and dispensing, or at this point, registering folks for the dispensing of vaccinations. So thank you all, and thank you, Dr. Walker, for continuing to work with those folks. One other thing that he mentioned also is that we will sometime soon be going into the next phase of the vaccinations, and that is opening up to a larger group. At that particular point, I'm certainly going to register to receive the vaccination, as I suggested very early on in this process. But to be clear, there are certain segments of our population that are equally deserving, but certainly more vulnerable than some, and those would be first responders, healthcare workers, and things of that nature, and particularly our senior citizens. In fact, Dr. Walker, I'm not sure if he mentioned it, but he also is working on an initiative to make sure that all seniors in the community have equal and ready access, I guess more importantly, to the vaccination, and that's being demonstrated in the assistance that's being provided them in helping them to register. Excuse me. In conclusion, in the past year, there have been times when we have made real progress in our fight against the spread of COVID-19 virus, and there's been times when things have gotten a little worse. This is an ongoing challenge for all of us, and if we continue to use face coverings and practice social distancing techniques and comply with prevention orders and policies in our businesses, schools, and houses of worship, we will continue to make progress. So let's stay focused, let's certainly stay safe, and let's continue to check on our neighbors, family members, and friends. And please remember, as we often always say, if we stay patient and calm, we will get through this together. Thank you.